all those macromolecules to look for inflammation, scent rate, CRP, ferritin, things like that, that's okay. But if you want to take a deep dive and really kind of put in the crosshairs and say, is this community inflamed as compared to others because of the off-gassing, that's where I would look.
Yeah, remember that way back when, and it came through you, I don't know if it was your office or individually, we had our blood work done. Someplace on Balboa Boulevard.
Yes.
Quest, was it? Yes. And what happened?
No, it wasn't Quest.
It wasn't Quest. Okay.
No, we never used Quest.
I don't remember who it was, but I just remember going there. Do they have, I mean, that was right after the explosion. I mean, it was relatively.
Sure, they have that, and we use that as part of the CBC study, of which we found significant
So UCLA
difference.
has that, so they can do a comparison to whatever blood work they're going to do now?
Those labs would be held in the offices, and since I was terminated from my position as medical director, I have no access to those labs. I have no access to your medical records.
But
We did obtain the Quest
can
data.
you louder, please?
We obtained the Quest data.
You said it wasn't Quest.
It wasn't Quest.
Was,
The one in Kansas City, the one we sent out.
no, that was Great Plains Lab.
Yes, that's the one she's talking about.
That's not the CBC. The CBC was done in another local lab, okay? But the Great Plains study was sent to Illinois, and they did the hair, urine.
That was separate. I'm talking
Correct.
about blood work, because I remember getting my results.
Yeah, no, that was done locally here, correct. But again, that's the one that showed us a signal, which was run by UC Berkeley, okay, which is Martin Smith, which is one of the leading researcher directors, and Rappaport, which is doing the benzene oxide, which is another thing that UCLA could partner with at UC Berkeley, UCLA, okay, to look at benzene oxide levels.
How many samples happened at that particular time, and I'm still not clear whether you're aware of it. As you said Quest, and then other people are saying it wasn't done under Quest.
Okay, let me clarify. It was not done under Quest. I did not use Quest. I asked Quest for the data, and when they didn't get it, I sued them. Okay? I got booted out of court, okay, because the judge didn't think we could have it. When I presented my data to the Department of Public Health, they took the data and they said, we're going to run it ourselves because we were concerned. They went to Quest Diagnostics and they got information, ran it, and said, there's nothing to see here, just move on. That's what happened.
So the blood samples that were taken right after blowout that you're referring to, you all don't have that data. Is that correct?
They will not.
We don't have that, but we are working on a means of, because if you gave that blood to a lab, you got your results back, right? So we're working on a way to securely receive anybody who wants to volunteer their health data that was obtained at that time, so that we can look at that. There are some challenges with different labs using different processes that makes it hard for us to analyze across them, but we want to receive whatever you guys have that you're willing to give us.
But the good news is if they're doing another CPC on you, they can start a study within a study.
And
Why not look at that data again as compared to controls?
And many of us went to our own doctors then.
that's why this was a request that came out of the community meetings, that you wanted to volunteer your health records. It is very sensitive data, as you know, and with our human subjects research protocols, it will take us some time to create a secure portal, but we want to be able to receive that from you.
Any other questions? Craig?
Yeah, so the birth study, I get your point. I mean, it was compared to LA County, and then for others that weren't aware, when they presented the birth study to us in the community, they compared it to a control group, which is more like us, but not, adjacent to a gas field. Since this is a retrospective study, Doctor, they went back and looked at existing data, right? Do you have any rationale in your mind of why our legal firms, when they were trying to assess damages?
I don't know, I'm not an attorney.
Yeah, but wouldn't that be a decent way for them, if you're trying to assess damages, you've already said, these babies are born, they're going to have long-term health concerns. And and hopefully nothing happens, but they're at a higher risk. So wouldn't that be considered the end?
It's sad that I think it happened.
Yeah.
I'm disappointed that they didn't do that because, I've done expert work over time, and there's an issue between scientific conclusions and legal conclusions. You need 95% to say there's causation in science, at least, if not above. In legal, it's 50 or above. You can just say it's more likely than not a probability that this was causation. And it's pretty impactful. And plus, when you look at all of the things in the science and so forth, and you look at Bradford Hill and you look at what's going on, there's one thing that stands out that really points to causation. Dose response curve. It's real simple. The closer the people got to ground zero, the higher the signal. It's like, what the heck? I mean, doesn't that say anything to all of the science people? But we're afraid to say causation because of the impact and the ripple effect and blah, blah, blah.
That's how the semblance went. The closer proximity to the epicenter of the
Yeah.
gas leak.
It's a different system. Science and the legal. Any other questions, thoughts, issues, concerns? Great.
Thank you so much, Dr. Nordella. And now I'm going to introduce the co-founder of Safe Porter Ranch and a very brave survivor of the blowout, Canoga.